Okay, good afternoon, everyone. I'm Jim Rooney, President and CEO of the Greater Boston Chamber of Commerce, and I want to welcome you to the fourth installment of the Chamber's AI Advantage event series. Our first event coming after Labor Day. We've got a busy calendar now that we're back, and I would encourage you all to take a look at the Chamber website for our robust agenda that we have for the fall and going into 2026. But today is an AI Advantage event. We have a healthy audience, about 200 people registered, so it's something that is on people's minds. When we launched this event and thought about AI in the business community and the role of the Chamber, one of the things that we heard loud and clear is people want to learn from each other about how AI is being deployed. Our chamber launched the AI series to ensure that people and businesses have this platform to share strategies, learn about challenges, and seize the opportunities connected with AI. AI continues to reshape industries, but few areas are experiencing its impact as profoundly as healthcare. And what better way to find out about that than ask innovators that are thinking about this every day? Today, we'll hear from senior leaders across the healthcare and technology sectors who are at the forefront of this transformation. We all know that our region is known for producing medical breakthroughs and life-saving treatments and cures because of our world-renowned hospitals and research institutions. And as we consider the immense economic impact of the region's medical institutions to our local economy, we also must try to understand how AI is impacting how our hospitals will operate and possibly streamline, how this will affect the patient experience and what it will mean for patient outcomes, and how research will be conducted and accelerated. This afternoon, our expert panelists will offer their insights about the current state of AI and future of technology in the world's most esteemed hospitals and, dare I say, really the healthcare and research capital of the world. As we navigate the ongoing AI revolution, the Chamber is committed to leading the business community in conversations to explore the future of technology across industries and sectors. Before we begin, I want to thank our sponsor, Comcast, for partnering with the Chamber to make this important series free and open to the public. And with that, I'd like to pass it on to Brian Jensen, Senior Director of Enterprise Sales at Comcast Business, to introduce our panelists for this discussion. Brian?
Thank you, Jim. Good afternoon, and thank you for joining us for today's event, AI Advantage, AI's role in the future of healthcare. I'm Brian Jensen, Senior Director of Enterprise Sales for Comcast Business in the New England region. My team and I are regularly meeting with businesses about our full suite of global technology solutions, including fast, reliable connectivity, secure networking solutions, advanced cybersecurity, and a range of managed service options. At Comcast, we know how important connectivity is, so we are continually investing in our networks to provide the most reliable internet in the country to ensure we meet our customers' needs now and well into the future. In fact, over the last 3 years, we've invested nearly $900 million in technology and infrastructure investments, including upgrades to our network across Massachusetts. On behalf of Comcast Business, we're pleased to be able to partner with the Chamber and sponsor this dynamic panel discussion that brings together leaders to explore how artificial intelligence is transforming the healthcare landscape. Today's conversation will dive into the real-world applications of AI in healthcare, the opportunities it presents, and what the future may hold. We're honored to be joined by 4 exceptional leaders. First, I'd like to introduce Chris Coburn, Chief Innovation Officer at Mass General Brigham, whose pioneering work has helped drive innovation across one of the nation's leading healthcare systems. Next, Jazz Tabakawala, Managing Director and Partner at Boston Consulting Group, BCG, who brings deep expertise in digital transformation and strategic leadership across the healthcare and life sciences sectors. Next is Prem Somasundaram, Chief Information Officer at Blue Cross Blue Shield of Massachusetts, whose leadership is shaping the future of healthcare technology and data-driven care delivery. And last but certainly not least is Joy Brown, Senior Vice President and Chief Digital Information Officer at Boston Medical Center Health System, whose experience is at the intersection of digital strategy and enterprise transformation, brings a vital perspective to this conversation. Their insights will offer a helpful perspective into how AI is improving patient outcomes, streamlining operations, and shaping the future of medicine. Thank you, and I hope you enjoy the discussion. I will pass it over to Jazz.
Thank you so much, Brian, and welcome everybody to what we're hoping to be a rather engaging and also enlightening conversation today. And thank you to the panel members for joining us. Maybe the best way to get started, right, would love to get sort of your perspective on AI. As Jim pointed out, right, hey, Massachusetts has some of the world's most renowned medical institutions, research institutions, all of which are being sort of, inundated with this conversation of AI. But no conversation of AI today takes place without, sort of a little bit of, hey, is it all hype? Is it all doom and gloom? Are we looking at sort of, the next big invasion of robotics? What exactly is this sort of coming at us, right? And maybe with that in mind, Chris, maybe would love to get your perspective. Is this real? Hey, Chris, you're on mute.
You would think after 5 years, one would know that. So just thanks for that question. It is real in the sense that things are happening and it will profoundly change healthcare. But at the same time, it is awful early. But this is all those years when we were all talking about the internet and we were still faxing during that period. And I think the same is true here. It will affect every phase of care, whether it's diagnostics, management, drug discovery, the administrative, but there's really not a whole lot of successes to point to. There are some, and it is achieving a level of ubiquity. I love the way Jensen Huang from NVIDIA describes it. Let's not get obsessed with calling things AI. His definition is AI is software writing software. And just get, see that as we see all those other electronic tools. So again, great potential, but very early.
Brayden, maybe your perspective.
I think Chris was spot on. It is real. Right? I think, when I was at a conference where they said when they initially showed this to Bill Gates, in early part of 23, Bill thought it was not possible. Or rather, it was possible probably 5 years or 10 years from 23, right? So the pace at which this innovation was brought to life was monumental. And it just showed up. I mean, this was not like one of those things that took a lot of time and energy to put together. It just showed up, right? I don't think, and it showed up to the broader, ecosystem than any other technology in the past 20, 30 years. So that obviously created a hype cycle. It also created a lot of curiosity, right? So from my opinion, it is absolutely real, but it is very important that we know how to play with this technology, how to make it real for folks that we care about, and how to make it real for the company, and how to make it real for the broader population. So I think the most important thing is, yes, the technology is real. Now, what are we going to do with it?
Joy?
Thank you, Jazz. Appreciate the question. Agree with my peers, Chris and Prim here. It's very much real. And it's a progression. Like most new technologies, there are phases that come before it. And in some cases, the phase that we're in is the most recognized by the broadest audience. I would say, thinking back to early days as a chief data officer and building out models that are at the foundation of what AI truly is based upon. Now we're at a place where we're talking about large language models, right? And so a level of complexity that we as human beings wouldn't have been able to get to on our own. And now we have the compute power behind it, along with all of the other aspects that are developing in the hardware space that was mentioned by Chris. I think it's real, and organizations are really assessing how can I best use it. And so I think this conversation is going to really get to the heart of that, particularly for healthcare.
Joy, love that perspective from all of you. Maybe let's pick up on a point, maybe with you directly, right? So maybe in my career, at least I'm seeing this maybe for the first time, where the technology might genuinely be outpacing our ability to think about where to deploy it, right? Which is usually has been the reverse, right? There's been great demand, and we're sort of building tech associated with it. As Prem said, this sort of came as an avalanche towards us. But here's the other side of it, right? So, okay, it's there. These big language models are all out there. What's your take on how do you manage the risk, right? There is a lot of conversation around, hey, do we even really understand how all of this truly works? So some thoughts from you, Joy, maybe on how do you manage the risk?
There's some building blocks and some foundational components that, as mysterious as AI can sound, it really gets back to some of those foundational building blocks, the data and the information. Do you feel good about the data that you have? Do you feel good about what I'll refer to as your metadata, or the data you have about the process that produced that data set? Do you feel good about the ability for AI or the models that you're looking to put in place? Are they at a place where that particular process in a business area or in healthcare, that particular area of either patient impact or clinician involvement, is it mature enough where automation using models would not create a level of risk that would create negative outcomes? For Boston Medical Center, at the heart of everything we do is access to patients, for patients, and making sure that there is equal access no matter who you are or where you're from, but most importantly, quality of care. And so I think every organization, just like us, is evaluating not only what the capabilities are in the marketplace, but is it a level, when you assess the risk involved with putting some of those in place, are we ready in that particular use case?
Chris, Prem, if you'd like to add to it, otherwise
Yeah, I mean, just building on what Joy said, and obviously she's in a central position at BMC. Risk management is part of being a provider. Virtually every activity that a hospital or hospital system is engaged in involves a conscious effort to reduce risk. And I think it's the same thing here, that it's that framework, that SOP, that experience that helps to drive down the level of risk. Personally, I think a complexity here is, the unending hype on generative AI, I think makes it hard for those long-established organizational processes to kick in, because, if it's going to solve every problem and it's going to, increase margin, reduce expenses, where do you start? So I think that still is an issue. And then, it gets back to a lot of the foundational challenges about AI in general, the biases that are built in, the future applications run the risk of amplifying the downside of using the new technology.
Chris, great point. And maybe take a double click on that one, right? So you said two things which I think are absolutely important here. One is around the bias side of it. The other one is, hey, at the end of it, it is all about everything catching up with how we sort of do work today, right? The hype cycle side of it. In there implicit, I think, is how do we build trust in the technology, right? Would love to get your perspective on how do you build trust with clinicians who might be using the technology at the diagnostic level, patients who are going to get, everywhere from, doing searches that are going to involve AI and all of the challenges associated with it, but may well be interacting with AI models as part of their healthcare journey. So how do you build that trust, do you think?
I'm no expert, and obviously we have a terrific panel, but on any relationship, and in the sense this is a relationship between us humans and the ever growing sophistication of these electronic platforms. Start small, build confidence. So when you talk about clinicians, we were an early adopter of the Abridge software system. We're also investors in the company. We additionally use the Microsoft Nuance tool as well for ambient documentation. And I would imagine others on this call are pretty familiar with it as well. I think the beautiful thing there is it is ideally reducing a burden for clinicians and giving them back a little bit of time. Whether it's ultimately a game changer, I think that's in the future, but to make home life more manageable, to provide a service is a wonderful way to build confidence. And the more effective these technologies are, I think the more they get used, and that level of trust goes way up. Those companies are Bridge, now Epic, Ambience. They're moving into revenue cycle management as a parallel capability with the ambient documentation. And just to be clear for the audience, ambient documentation, the simple way to describe it is clinician puts a phone or some device on the table between them and the patient. They have a conversation as normal people would, the kind of exchange, going back hundreds of years between doctor and patient. Within a minute, usually within 30 seconds, a wonderfully composed note is created by the system, and it's done not in chronological order, but in logical reference building for future care. So it is an awesome technology, but it is early, and its benefit is defined to certain categories. But your question of trust, I think this is a great example of starting on a target and growing from there.
Great. Prem?
Yeah,
Thoughts?
I think as organizations, especially in healthcare, we have a huge responsibility in enabling the trust. And one of the first things for businesses, in our domains, especially, is to potentially unlearn probably decades and decades worth of thinking. We are starting, but to Chris's point, right? We will slowly graduate into incorporating this technology, this capability into core of what we do. And if you layer this technology on top of what we are doing today, goes back to, will we actually realize the potential the right way? We might realize the potential, but may not be in the right way. So from my vantage point, I would say one of the fundamental things for us as a healthcare organization is to unlearn and start thinking about it a little differently as we move forward with how to realize this potential. And I'll also add that, going a little bit deeper into this, we have been programmed to think in a deterministic way. What I mean by that is there is an input A, which will deduce to an output B, right? So that is being deterministic. In the generative AI world, specifically kind of picking on generative AI, input is A, the output could be B or C. Both B and C are correct, basically. So as an organization that has worked so well in the A to B construct, shifting that mindset to go from A to B or C is a big shift. And if it is a big shift for us as organizations, as enterprises, the customer is going to see it even more radically different. And how do you balance that? How do you bridge that gap? So we have a responsibility to change manage this, to kind of help the adoption of this technology the right way that will actually benefit the customer in the long run.
Love that thinking, Prem. But then the most obvious follow-up question then becomes is, okay, so whose A to B model gets changed, right? When you look with the audience within the healthcare world, whether it's clinicians, nurses, patients, administrative staff, right? Where do you see the start of this journey? Where do you see hey, this is where we've got to break the A to B model?
Yeah, that's a great question. First, I'll start by saying there are certain A to Bs that we cannot change and we should not change, right? Taking that out of the equation. Then, you have models where you start thinking about how do you go from, A to B or A to C. It kind of starts into a different paradigm from an understanding perspective. Like, so kind of, you're asking a question, right? Like, does it disrupt our clinicians? Does it disrupt? I think anyone that we need them to practice at top of their license will and should get disrupted. What I mean by that is, if I take our clinicians, for example, right, we have a phenomenal team of clinicians. And what we want, our ambition is that we want them to spend the time on the phone with our members where they can be most impactful to our members versus doing paperwork. So I think that is the fundamental paradigm shift, I think, right? So the A to B or C, comes into that area where you got to think about how do you enable the workforce to practice at the top of their license.
For either one of you, Chris or Joy, right? I'd love you to take sort of Prem's idea of, hey, people are going to get impacted or journeys are going to get impacted, right? Maybe do a little bit of a deeper dive into it, right? Where do you see the start, right? Is it in patient-facing models, right? Hey, there's going to be, I'm making this up now, a bot that's going to answer your call when you come in instead of it being somebody who would typically take your call. Is the Q&A that you do with patients sometimes prior to an engagement with an HCP going to be handled by a bot, right? Where do you see the start of this? Or is it more internal? Is it more, Chris, where you were going, right? It's a little bit of it's a help on the administrative paperwork task force. Where do you see it starting? And where do you maybe see it having large impact?
I think it's all of the above. In our case, what we're seeing, just to even that question of it, who, where in the system, and then how do you actually persuade and influence people to feel the importance of it? I think the reality is day in and day out, the clinicians as well as the operations teams, at least here, they're actually bringing solutions to the technology organization and saying, we want to try this. We want to see what we can do with it. And I actually think that there's a spectrum, right? So there are many that are really excited and we can't move fast enough to put things in place. And I think there are others that are a little more hesitant. We first start with, what do we need to provide for patients? The right care at the right time, the most efficient and the most accurate and high quality, and making sure that the places we're putting it allow us to even increase our opportunity to do that well. And then as a clinician, focusing on getting to that outcome as quickly as possible, is particularly in urgent situations. So a few of the places that we're using it to your point, just to kind of get to very specific aspects, for example, with our OR scheduling, making sure that you're looking at the inputs of various surgeon schedules, you're looking at the availability of patients, and then putting together recommendations on how do we actually improve the speed at which we can schedule, but also enable patients to schedule themselves ultimately as an end result. But you don't get to that outcome on day one. And so you slowly progress yourself towards that level of automation using the capabilities that are in place. These are a number of the things that we're piloting and we have, just in the hopper. But the piloting and the proof of concept work is just as vital to figuring out where you go first, second, or third. Things like, regionalization or placement. There are a lot of moving parts to getting patients and physicians together in the right space as quickly as possible in an inpatient situation, and making sure that we're testing that out as those solutions come to market, either within an existing solution that we have where they've added it, or an outside provider, but building models that help with that real-time placement. So in that case, you have the administrative staff that are bringing patients in and trying to gather information, and so putting automation around that. The physician themselves, how are they getting to the right patients and knowing where they are? And then the patient, they're getting to the outcomes that they need more quickly. So I'd say everyone involved is being impacted, some more than others. And you tweak it and continue to evolve it as time progresses. Once you've figured out that it's doing A well, then you can move to B, and then ultimately, hopefully, get to F without going through all of the phases to get there. And I think that's the power of some of these models.
Absolutely. From a Blue Cross Blue Shield standpoint, right? Where biggest places where you guys are deploying it today, maybe, and seeing the impact currently?
We are spending a lot more time on the customer experience side. And again, want to center back on the theme of enabling our associates to practice at top of their license. So for example, if they need an ID card, our members probably don't need our call center associates to be on the line, right? Versus, let's say if there's a complex question on a claim where they need a lot more cycles from our associates. That's basically where we are focusing on, right? So obviously we're starting at that spectrum. The other area is admin efficiency or administrative efficiency, right? Believe it or not, right? We do process a lot of faxes today, right? That is always an area of opportunity. I'm just giving one example here, right? When we receive faxes from our counterparts, we spend time and energy to process that. I mean, that could be time well spent, and we look at areas like that as an opportunity. So at a higher level, currently we are focusing on these two pillars, which is, customer experience and administrative efficiency. And we have explored, we are exploring things like voice enabled AI. Again, that's not new, but with generative AI, it kind of takes a little different flavor of how it responds. So we are exploring that in the customer experience space. And then in the administrative saving space, we are exploring things like intelligent document processing or IDP to kind of reduce the overall cycle times when it comes to processing.
Nice. Chris, you're talking to a lot of firms, not just, as part of your role. What are you seeing as the big emerging trends?
Well, yeah, maybe just to try to parse a little bit of the last two comments in addressing that question. So, for instance, next week we have our big annual World Innovation Forum, and John Reed from the CMO of Amgen will be speaking. They are doing some very, very elegant work now, applying the technology on drug discovery, on patient interface. And you can see a heavy investment, a significant priority in the company. And I think, we all need to be realistic about the provider element, that, what's happening in the hospital systems as it relates to a new technology like this. When I was at Cleveland Clinic, I remember an enormous investment that they had when they constructed their heart hospital for automated delivery, supply delivery, basically robotic carts that moved through the system. And at least as I remember that was built around a vision of future care. It was not directly addressing the cost element. And I think as you try to identify areas where hospitals will deploy the technology early, you've got to confront the fact that 56% of the hospitals in Massachusetts, or last time I saw the statistic, were negative margin. So consequently, you lose the opportunity for nice to have. And it's the things that have a direct impact on, financial viability of an institution that will go first. And so it will be things like revenue cycle management. Now, I have to say, we're the largest academic research enterprise in the US. We have almost 7,000 Harvard appointed faculty. And when you sit with them, it's hard to find someone that isn't trying to incorporate new technology, particularly generative AI, into their own work. So, I would say institutionally, the priorities are going to be around things that make the entire system, the organization itself, more efficient. But at the same time, you will have hundreds, really thousands of really smart people in our organization working to apply the technology at their level.
Chris, well said. I mean, I can certainly tell you from a BCG standpoint, right, where you went with it, is we are seeing our clients experiment in just about every aspect of how work is being done today, right? So discovery, absolutely. I mean, that is the ultimate promise of this technology would be, if we can go from discovering drugs to designing drugs, the ability to sort of make sure that the pathway you're on almost is a guaranteed sort of success model as opposed to the attrition we currently have. And then down all the way to, patient selection models for clinical trials, to commercial models, to manufacturing models. I mean, it's ubiquitous at the moment, certainly, right? As you would expect. But it's leading to an interesting question, right? Which is, but no one can do this on their own, right? This presents just an absolute amazing opportunity for everything from academics to healthcare providers to pharmaceutical companies to technology companies to sort of collaborate. Just would love to hear from you guys on, are you seeing that, or how are you, maybe given the power you have, honestly, how are you encouraging that type of maybe networking that maybe would not have happened in the past?
I'll just jump in. I think working with hospitals can be very challenging. And one of the reasons for that is there can be a glimmer of a potential benefit, but if you don't have the discipline and the rigor to try to quickly identify what is that shared activity and how is it going to be approached, you can chew up a lot of cycles. And as everyone on this call knows, the famous death by pilot. So as we think about a more collaborative future, I think we, as the biggest segment in healthcare, need to be better at being a partner and better defining what our needs are, how we're going to approach it, how we're going to measure it, maybe when we're going to back out of it. What is a success and what's something that requires a different direction. And at least for me, 25 years of working for some big systems, hospitals can be better at that.
I completely agree. I'm coming to this space from a few different industries, financial services, life sciences, media, and telecom. And one of the fundamental decision-making aspects around technology investment is the build versus buy. Mm-hmm. And if it's not one of the core value propositions of the entity, is that really where you want to double down and overspend? And so if you just think about those things fundamentally, there are a number of vendors in our space and organizations that provide consulting services that have already figured some of these things out. And so instead of going through the process of trying to do that on our own as healthcare providers, as well as healthcare systems, for many of us on the call today, leverage what has been already discovered, proven, and put those things and those capabilities in place, that software in place, so that your organization and ours specifically can spend the time on the aspects that are unique to us. And that's how we're managing through both use case selection, vendor selection, really going with providers like the ambient note-taking example, where a provider that has already proven the ability to do this well, particularly in and integrated with the other solutions that we've already chosen for our organization that are not going anywhere. And so that has been I think a time save for us in terms of not spending time in the wrong places, but making sure that it's additive.
Yeah.
And adding to that, I would say like partnership is not an option. It is a must at this point, given the speed at which the technology is evolving and the learnings that we all need to share. And I appreciate the chamber setting this call up. I mean, this is a great learning opportunity. Similar to this, we are doing it. So, for example, there are 34 Blue Cross plans in the country, and we exchange information, share our strategies when it comes to AI, what works well, what doesn't work well on a regular basis. And also from a partnership perspective, given where the technology is in the on-ramp, right? I think the investments cannot be done just by one entity, or the amount of time and energy that we want to do in cracking a specific use case, it cannot just be done within one construct. So I think it's really important from a partnership perspective to kind of pick and choose to say, so that we can kind of isolate signal from noise. And also because there's so much activity in this space, a lot of really cool concepts coming to life, but not everything is going to make it out of the gate. So what are those things that will work well? What are the learnings that we're seeing from some of the bigger players? And I would say that now more than ever, what we have seen is that level of partnership is not just across the health plans, but also across health systems. We talk to most of the health systems within our Massachusetts ecosystem to learn from them, to see what they are doing, and similarly we share our learnings as well. So partnership is a must, and now more than ever.
So sorry, Chris, were you going to say something?
Oh,
So at BCG, one of the strongest positions we've taken when it comes to AI is, this concept that says, hey, it's about 10% is algorithms, 20% is tech, 70% is people, right? Which may sound a little contradictory, but, it builds on a point I think, Prem, you made earlier. It's ultimately there's a change that is coming, which is impacting people at the end of the day, right? Would just love to get your perspective on what are you doing within your own organization to prepare people for that change, to get people to that understanding and that acceptance level, to the retraining that might be taking place, right? Just wondering if sort of how that journey is going.
Yeah, I can start. I think upskilling or the AI fluency and AI literacy is of paramount importance at this point, of depending upon what your strategy is. And the workforce, I would say our associates and what we are learning, and we are hearing this from some of our peers as well, there's a lot of shadow AI that is happening, right? There are folks that have access to a chat GPT like tool in their enterprise. If they don't, they have something on their phone, something on their laptop, personal laptop and such, that associates are using to fundamentally from a productivity perspective. So taking that into consideration and the speed at which this technology is evolving, there's different layers of this, right? One is at an executive level. I think there needs to be a vision and a strategy behind what is the art of the possible here, right? What do we need to think about, right? Or how do we want to, what kind of latitude and space do we want to create within the ecosystem for the company to adapt and evolve within this technology? So that's one. The second is at the workforce level, right? Having the right level of training and adoption that says, how do you fundamentally, what kind of tools, like there are different tracks. There are going to be AI practitioners, right? Meaning like folks that will actually build AI tools. That's a different level of training versus, associates that will actually use AI on their day-to-day job from a productivity perspective. And then if AI is getting embedded into the common tools that we use on a day-to-day basis, how do I take advantage of the tool, right? So there's different levels of AI literacy that is going to be important for us as an organization. And, this is not one of those things where you start and stop.
Yeah.
This will be an ongoing process. There's a continuous learning mindset that, that needs to be incorporated within our learning ecosystem. And the AI literacy, I mean, I think you all probably have seen it. The latest MIT research that was published a couple of weeks back that talks about 95% of the generative AI projects, don't get an ROI. And one of the primary reasons that the research cites is AI literacy. If the AI literacy is not part of your DNA, it's not part of the core fabric of how you're building your strategy, it'll kind of put in a lot of hurdles. So, like you said, I mean, I don't know about the percentage, but it is super important to kind of anchor on the AI literacy and the program around AI fluency within the organization.
Joy, maybe same question for you on the people side, right? Or Chris, you, either way.
Yeah,
Go ahead, Joy. You go.
The more, you didn't ask this specifically, but one of the things that we've done internally is around data analytics and AI governance, and helping those within the organization see the connected tissue between those three things, and putting, in place specific committees focused on both policy to help us stay within a safe place, from a masses perspective, as people are experimenting and using the outside capabilities that are available to them in their everyday life. How do you use those but not put the organization at risk? And how do we create education? The second is being well managed and helping individuals understand data and its role in getting to really the reward that you're investing in AI for. And in a lot of cases, you will see very successful use cases externally, but you have to really reflect that what is our current state around data and the governance of it and the management of it, so that if we'd like to get to those same outcomes, we have to take a step back and make sure that we've prepared ourselves. And so we're putting being very thoughtful but still very measured around that sequence, what is in place and where we still need to develop and mature in order to get to or harness all of the outcomes and value that AI could create for us.
So true.
So just to follow on both those comments, it's such an interesting moment we're in right now as it relates to AI. You think about the questions you asked, Jazz. For me, some of that comes back to what will the impact be in the consulting sector or for law firms? And I'm sure you are spending a lot of time studying, but also utilizing the technology. What we hear is, the lowest stratas are quickly being replaced, and making the jump from, let's say, terminal education into a meaningful job will become harder, because that training work, that apprentice period, will have gone away because that work can be done by a machine. So that's just one question, just to observe that and think about those same parameters applying in healthcare. I think another thing, it just maybe a little counterintuitively, this is very much a personal opinion, but you look at big disruptions, the folks who are most able to find their own way actually wind up typically having a pretty fruitful course. So one might expect the level of entrepreneurship in the US will go up, because a lot of highly qualified people will have disassociated themselves from large employers. And that may be an overly optimistic view of that, but it is kind of scary to think of the societal investment to move a person up to a level, whether it's a lawyer or a consultant or a clinician or a scientist, where they invested, society invested in them, and then their job no longer exists. That's I think radically different than looking at the Midwest in the 60s and 70s, when so many people were dislocated who could have a semblance of retraining and then reentry into the workforce. Hard to say that when you've got 8 years of post-secondary education or more at risk. So, anyways, just a couple of thoughts.
No, Chris, I think you're bringing up a good point across the board, right? The way at least we look at it is it's not about job redundancies, it's about doing work differently. And I think what we hear from people in general is there is a huge amount of excitement on what they can do with AI, and there's a huge amount of concern on what AI is going to do to them, right? And I think in this current state where there is so much conversation around, oh, it's all going to get automated, you will not need humans anywhere in the mix. I think that there's a high level of a hype cycle associated with it. I think where Prem, Joy were going, there will certainly be certain job families that are going to get impacted more than others. But in our world, the way it always works out, and I mean our world in general, is every time you take some of these things away, there's new things that sort of open up, right? Hence our point around that 70% of this is about people at the end of the day sort of comes into play. Associated with that, though, right? Given the impact on healthcare as a whole, how do we ensure that voices from the healthcare sector are loud and visible and heard as policy is being shaped, right? Because the worry, of course, is that, hey, is it just technology companies that are going to push the envelope forward and somehow that becomes the prevailing wisdom, right? Or where's the patient advocacy side of it or the healthcare advocacy side of it on how some of the policies associated with AI will involve? Would love to get your perspective on that one.
Well, I think Joy is the chief digital officer, so
Yeah, you're touching on a few different things for me. One would be an issue that we've all dealt with as we moved from, just decision-making capabilities to machine learning and now AI. What is inherently in the data itself? And is it set up to really, drive us forward successfully, meaning things like bias. When you think about a lot of what people are saying about generative AI, making sure that you don't have hallucination taking place. So models putting things together that we as human beings would never put together, or we know are not realistic outcomes. And I think as the users of these tools and the buyers of these tools, ultimately, I believe organizations speak with their wallets and how they spend money, and with which providers of services they decide to spend. That for me is and also making sure that we are at the table in providing what happens when those pieces don't work well, and making sure that just like with anything, pharmaceutical products, medical devices, they all have controls and groups and organizations that are focused on making sure that, individuals are not adversely affected and that those circumstances are highlighted and things change. We have to put those same controls and that same structure around this as it's being built. And being in healthcare, we're the only group that can actually do that because we're living it. And also the reality is the consequences of not doing it well still sit with us. We still have a responsibility.
Yeah, I think couldn't agree more. I would say we do have to own the consequences, and which also means that we have to play a significant part in the policy discussion. And as organizations, who are, again, I always say this when I talk to my team, nobody picks up the phone and calls us because they are bored on a Saturday afternoon. When somebody reaches out to us, it's in the most critical time of need, right? And in that type of an ecosystem where our biggest asset is how we work with our members and our constituents, how this technology will impact them is of paramount importance. So, and how that policy there's policy at different levels, but in a grand scheme of things, just talking about policy in general, how we want to influence that policy to benefit our overall ecosystem is critically important, and how we participate in it and how much we like to show up is a big part of our strategy as well.
So true. So true. So I'm going to ask you to gaze into your crystal ball for the final question, right? Where do you see with AI, what happens to the healthcare world 5 years, 10 years from now? I would have normally asked 10 years, but Prem, to your point, this stuff is moving at quantum speed. So maybe it's 5 years, but pick a time frame, doesn't matter. What do you believe will happen?
Is that Prem's question? You get to let the pair
No, Chris, go on, jump on it.
I would say smarter clinicians, smarter patients, more comprehensive understanding. If you want to focus on the good side, and I see one of the questions here is encouraging all of us to watch a movie called Writing Doom, which I'm not familiar with, but I will look at it. Again, many risks, but the digital assistant, that concept's already there, and that will only get better. And I have to say, very interesting to me, one of our very top AI scientists, is a real leader in the field, reached out a few weeks ago because he's been contemplating some work on discovery application, looking at it predictively in terms of commercial markets. And we just were trading information over the last couple of days. And it's exciting to see what he's come up with. So here's a person whose day job is clinical diagnostics and using giant data sets and interrogative technologies, applying it now in an entirely different area that at least early on looks like it could cut some new ground. So that's exciting to us. So I think if you're focusing on 3 years, the relatively simple applications will be the ones that take off, and the idea of an assistant that makes everyone better at whatever their day job is very realistic and very likely.
I'll say that healthcare companies, especially like ours, we anchor a lot of things on data, and how the data can be leveraged overall will shift in the next couple of years. So that's the primary. And then I'll also add that at the overall level, we will start designing interfaces for non-humans, which I think we're already starting to do. I mean, the expectation is that, how we get apps, there will be personal bots that will be available for the broader population. And as industries like us, how do we support that will be a big evolution for us as we move forward. So, bot to bot, things like that will play a big role. But I think the foundation of all of this will be how we use our data to lay the technology on top of it will be the next 4 years.
Joy?
Yeah. My thought is we will know more, as already highlighted. I also think that very industry specific capabilities will start to present themselves. And tying in a little bit of what you asked previously, organizations like those represented on today's call will play a key role in developing and helping, whether it's a generic tech platform organization that is providing capabilities that can span many different industries, or if it's a niche solution that eventually is acquired by a larger platform company, there will be a level of sophistication that is industry specific. And all of the work that we're doing today as we were careful not to overinvest, but to invest towards what is, gives us measurable results for patients, clinicians, and everyone in the healthcare ecosystem. That work will pay off. And we'll start to see some clear, larger providers of these capabilities that meet a broad set of needs. Whereas today, it's a very crowded space. And like most new things as they mature, we begin to get much more focused on who the real differentiated providers of these services will be.
I think it's great, right? So maybe, given that all of us fundamentally work in this industry, focus on patients, right? So here's my little wish list, right? For this one, it is as a patient, right? When you're in a health situation, navigating the system is challenging, right? Between figuring out from the basics of like, hey, who do I even start with? The old Google diagnostic, all the way down to, if you get some challenging news, how do I even interpret it, right? Everybody's stressed for time, everybody's stressed on energy. I'm hoping that at some stage, every one of us has what I would call a patient concierge, right? Somebody that I can chat with that will help me navigate my health journey, that will figure out the complexity behind whether it's talking to a healthcare provider, whether it's a nurse practitioner, whether it's my insurance company, whether it's financial help that I may need to get things done. For me, I think if we could make that happen for a patient, it'd be the biggest victory this technology could have. So that's my little wish list. With that, I see Jim back on screen. Jim, welcome back. Last word to you.
Okay, Jazz, thank you, and thank each of you. As you were talking, I might try to squeeze in one more question, because I started by saying that I'm the chamber president, so it's my job to boast about Boston, and described us as the healthcare and life sciences capital of the world. And I'm wondering, from your perspective in interacting with your colleagues, not just here in Boston and Massachusetts, but across the country, how would you describe our leadership in the applications of AI to healthcare space right now, nationally and globally? And I'll say that on my mind, Chris mentioned his work in Cleveland, and I've had the opportunity to talk to healthcare leaders across the country. And some of them have described Boston as a bit conservative in the healthcare space as it relates to applications of technology. Specifically, I was down in Pittsburgh, and they were talking about their applications of robotics, and they said that Boston's going a little bit slower than they are on that. Now, I don't know if that was just fun or if there is a more conservative culture in applications of AI. How would you describe it? Are we leading in the applications? Are we conservative in the applications? Chris, you're traveled, and Prem, you talk to your colleagues. What do you guys think?
I would say you have to look across the country at these pockets of disruption and innovation. I don't know how many folks here are following HatGo, where General Catalyst, I think most of the leadership for that is from Boston, bought Summa Healthcare in Ohio, and they're trying to create a giant sandbox where they can bring through new technologies rapidly, assess them for effectiveness, and either adopt them or walk away. That deliberate model, I think, is really something. So I would acknowledge that a lot of those ideas came out of Boston. It seems maybe logical that they're in Ohio to try to build out the model. But if that works, it's going to be, I think, a source of a lot of new solutions that will affect everyone.
Mm-hmm.
I think the three components that Boston is industry and just we're renowned for many things, but these are the three that I think are going to be the determinant of where, in the interest of kind of the topic here, where we will be leading and Boston will be leading, and that is the number of universities and colleges and educational organizations, industry-leading healthcare. And then I see it as a bit of a tech incubator because of all of the academia that's here. So I think the technologies that will get the most out of those three entities, I believe, are where we will continue to be. Boston will be on the map as a place that is changing and moving the needle on the progress at which, in the pace at which this technology is moving forward. I think you're going to have other areas of the country that, specific to who is there, you will see different outcomes, but all progressing forward.
Yeah, 100% agreed. I think we have the right composition between the academic, tech, and the healthcare to be, not to be lagging behind, but rather, be a frontier when in exploring deploying AI when it comes to healthcare.
Well, great. Chris, Prem, Joy, Jazz, and our sponsor from Comcast, Brian, thank you so much for helping us put this together and sharing the information that you did provide. As many of you said, what we're hearing is people just want to learn from each other on this AI journey, and it's very early. So thank you for being a part of that. And to our audience, thank you for joining us. And please check out the Chamber website for our fall agenda. Look forward to seeing you soon. Have a great rest of the day. Thanks.
Thank you.